Welcome to Chewy Tubes. My name is Mary Schiavoni. I'm the originator of the Chewy Tubes and the author of the Jaw Rehabilitation Program. Let's take a few moments today to talk about the Jaw Rehabilitation Program. What is the Jaw Rehabilitation Program and who should use it? The Jaw Rehabilitation Program is a patented treatment methodology designed to develop biting and chewing skills. The Jaw Rehabilitation Program is a series of goals and objectives designed to develop behaviors of the jaw which are fundamental to the development of biting and chewing skills. The purpose of the Jaw Rehabilitation Program is threefold. First, to initiate appropriate pre-biting mandibular movement in response to oral tactile stimulation. Second, to develop this movement into functional, rhythmical patterns of jaw motion. And third, to refine and strengthen these functional movement patterns through a series of treatment activities. The Jaw Rehabilitation Program specifically focuses on developing tone, strength, and function in the masseter muscle. The masseter muscle is responsible for closing the jaw. This program develops more mature mandibular function by guiding the patient through a sequenced progression of oral motor exercises. The Jaw Rehabilitation Program highlights the use of Chewy Tubes oral motor tools. The Jaw Rehabilitation Program is divided into 7 levels of treatment. Each level of treatment has 2 long-term goals. Each long-term goal is further subdivided into several short-term objectives. These objectives lead to the successful outcome of the long-term goal. Levels 1 and 2 target development of prerequisite sensory and motor skills that are needed for biting and chewing behavior. Levels 3 and 4 target the development of early patterns of repetitive vertical jaw movement, gradually building on these skills toward higher abilities. Levels 5, 6, and 7 target development of more mature patterns of extended rhythmical and repetitive excursion and closure biting motion. Let's talk about some of the treatment uses of the Jaw Rehabilitation Program. The Jaw Rehabilitation Program is used effectively with patients who are delayed in developing oral motor function for biting and chewing skills. It is also used to coordinate vertical movement of the jaw with placement of a bolus laterally within the oral cavity. The Jaw Rehabilitation Program is used to develop symmetrical and repetitive mandibular function for mastication of firmer textures. And finally, the Jaw Rehabilitation Program is effective in helping patients transition from enteral feeding to oral feeding. The Jaw Rehabilitation Program is appropriate for treatment with children and adults. It is appropriate for individuals with diagnoses such as autism, cleft palate, Down syndrome, dyspraxia, neuromuscular disorders, cerebral palsy, stroke, traumatic brain injury, and dysarthria. Let's look at some examples of patients using exercises from the Jaw Rehabilitation Program. In Level 3, Long-Term Goal 2, the patient will demonstrate 5 cycles of repetitive up-down jaw movement. Place the Chewy Tube securely on the patient's molar dentition and begin. 1, 2, 3, 4, 5. Repeat this procedure on the opposite side. Secure the Chewy Tube on the patient's molar dentition and begin. 1, 2, 3, 4, 5. In continuing our program, on Level 4, Long-term goal number 1, the patient will demonstrate 10 cycles of rhythmical, repetitive, excursion and closure biting motion on the Chewy Tube. Place the chewy tube on the patient's molar dentition and begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Repeat this procedure on the opposite side of the jaw. Place the chewy tube securely on the patient's dentition and begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The patient can practice these exercises independently at home. Let's review these 2 exercises. The patient will demonstrate up and down jaw motion 5 times on the chewy tube. Again, in the patient's home exercise program, he can practice these exercises independently. The patient will now demonstrate 10 cycles of repetitive up-down jaw motion. To learn more about chewy tubes, please watch our informational Chewy Tubes video on chewytubes.com. The jaw rehabilitation program can provide a quick reference of outcomes and exercises for patient practice at home. Under the direction of a therapist, the patient can be assigned a specific objective that can be easily identified in the jaw rehabilitation program. It is recommended that an assessment of the jaw be completed for each patient before beginning work on the jaw rehabilitation program. The jaw assessment form offers a thorough guide on which to document a patient's pre- and post-treatment level of function. The components of the jaw assessment include structural integrity, range of motion of the jaw, dentition and alignment, functional movement of the jaw, quality of jaw motion, and food texture. It's been a pleasure speaking with you today about the jaw rehabilitation program. Please visit us again online at chewytubes.com.